Hi, everyone. So I'm getting ready here. We're just going to wait another minute or so before we get started, and so we can get everybody situated. All right. All right, I will get started. I want to thank and welcome everybody. I am Emma Valinsky, and I'm the Manager of Policy and Programs for the Executives for Health Innovation. Thank you for joining EHI's webinar today. We have a fantastic discussion happening today. Quickly, we are EHI, again, Executives for Health Innovation, and we are a catalyst for healthcare transformation, convening diverse leaders from across the industry to unlock opportunities for collaborative innovation. We are here to bring all the different types of voices to the table so we can hear all perspectives. For 2022, EHI is focusing on modernizing public health, health equity, privacy and security, and virtual care. So you'll see a lot of events coming up. If you're an EHI member, I've got the screen up here. You can see all of our wonderful members. Then you'll know these events are coming up. But there's also some online education happening for those who are not members. If you'd like to be a member, and we would love for you to be a member, you can just go to ehidc.org for more information. And on that note, I do want to add that we have this public health modernization series that you'll see a lot of information about, and we're really excited about it. So feel free to join on in. And yeah, so I'll get us started here. So we have our webinar from Step Tracker to Health and Wellbeing Companion. Google Doctors discuss the evolution of Fitbit. So I want to introduce our speakers. We'll hear from them at the end. We have Dr. John Moore, the medical director for Fitbit, Google, and Dr. Kapil Parakh, MD, medical lead of Fitbit and Google. So feel free, if you have any questions while we're going along, put them in the chat. We'd love to hear from you, and hopefully they can get to them at the end. So I think, Hope, you can start sharing.
Can y'all see it?
No.
Oh, no.
We're good.
Okay.
Impact in the real world. I'm really excited to introduce our experts today to Google doctors who have seen Fitbit's impact in real-world clinical experiences. Dr. John Moore is a biomedical engineer, physician, and health behavior change scientist who served as medical director for Fitbit. He left his clinical career path determined to develop solutions to improve healthcare delivery and earned a PhD from MIT. His research included the intersection of health psychology, learning science, and human-computer interaction. Dr. Kapil Parakh is a practicing cardiologist who served as a medical lead at Google. Before Google, he served as a White House fellow and was the principal health advisor to the Secretary of Veteran Affairs. As a clinician scientist, he's published over 35 papers, many on psychosocial factors in heart disease. You can also check out his book, Searching for Health, recently published by Johns Hopkins Press. Welcome, Dr. Moore and Dr. Parakh. I'll let you two take it from here.
Thanks so much, Georgia, and thanks everyone for joining us today. We really appreciate you taking some time with us, and thanks Kapil for joining in this conversation.
Oh, I'm excited, really excited for number of people here, and I think it'll be a fun chat.
Absolutely. So Kapil and I are part of a team of clinicians that support Fitbit, and we support them through the process of early R&D, where products are invented, through to building out those products, validating their impact on people's health behaviors and their health outcomes, all the way through to working with health plans and health systems, researchers, employers, etc. So we have this team, and a really fun environment, really exciting time to be at Fitbit as we invest more heavily in helping people to succeed in their health journeys. And just this exciting group of people that hopefully we can share some of that with you today about how it blends into all of our products and services. But I'd love to get your thoughts on what it's like to be at Fitbit during these exciting times, Kapil.
Yeah, no, thanks, John. I mean, that's one of the best things about working at Google, right, is the breadth and depth of talent in the company. So I've been at Google 7 years. It's been quite the journey, and I'm still learning every day from different people. And I think that over time, we've seen the investment in health grow, and there's just like a really phenomenal team from folks who have expertise in sleep to women's health to, cardiologists like myself, and, with your experience in behavior science. I don't know, I think it just makes the work exciting. It adds rigor. It makes it fun. It's a really cool time to be in this space.
Yeah, and it's really exciting to see how that all comes into the product and bleeds into people's lives within our mission, which is to help everyone in the world become healthier, which couldn't be a more exciting vision to be a part of. And obviously, all of you here on the call, a really important part of how do we get these kind of empowering technologies out to as many people as possible to make a difference in their lives. So with that, we're going to take a systematic approach to kind of walking through the principles behind wearables and Fitbit and how that's evolved over the years, and taking a clinical and scientific lens about why some of those pieces are important, what do they bring to the field, and what do they bring to the lives of people who use them. So we're going to start with talking about behavior tracking. All of you know Fitbit started with tracking steps. And what it did that was a bit different was it took something that was really hard for people to comprehend. Before you had a pedometer or before you had a Fitbit, how many steps did you get in a day? People had no clue. And it was also pretty boring, right? If you just had a pedometer that just spit out a number to you, what do you do with that? How do you get engaged with that? And Fitbit's contribution was really to make that fun and inspiring and help you to set goals and maintain streaks and make accomplishments and do it in a social way. But the importance of steps is something that is still growing, right? The evidence behind that. So I'd love to get your thoughts, Kapil, about how relevant just getting steps in a day still is when it comes to people's clinical outcomes.
Oh, absolutely. I think it's super important. So I still remember as a cardiologist where I would, seeing a patient, like, this is sort of when the first Fitbits came out, I had a pedometer, I would like flip it open and show it to them, or I'd show them a tracker and say, like, this is important to get people moving. And if you really step back for a second, if you look at the physical activity guidelines, they're like 700 pages long. That can be summarized into two key statements. One is move more, and the second one is huff and puff sometimes, which is like, try and get your heart rate up. And I think people overlook the importance of just movement and getting up and about and getting something as simple as your step count as a way to get you engaged in that movement, so that it's not just a punitive thing like, oh man, I got to get up and move again, but it's like something interesting and exciting that you can pair with your friends and compete. And, it adds a little bit of fun to something that's also good for you.
Yeah, absolutely. And this evolution is now that, so we started with those steps, but now we have tools around activity, nutrition, sleep, and mindfulness. Arguably the four foundational behaviors that apply to everyone out there, right? We really need to eat better. We need to sleep well. We need to move more, and we need to be mindful and manage stress. So I'm going to take an approach where we dive through each one of those in more detail, starting with activity. We talked about steps, but now Fitbit does activity tracking, so it tracks your exercises automatically. It promotes less sedentary behavior. So there are things called reminders to move that throughout the course of the day nudge people in the right direction, show them just how close they are from doing a small thing that can make a big difference, which is to get at least 250 steps per hour. We have a readiness score that has just come out that's trying to think about how do we not always push people relentlessly, but think about balance, right? Making sure you balance your behaviors. And what I want to dive into most with you, which you touched on with huffing and puffing, is active zone minutes. So yeah, dive in more about what you were talking about with huffing and puffing and how active zone minutes ties into that.
Yeah, no, absolutely. So when the guidelines suggest that you should huff and puff more, which is sort of my colloquial way of explaining that, and this is the so the U.S. federal guidelines and the American Heart Association guidelines are all consistent on this. What that really means is that to get more technical, is they want you to do an activity that gets your heart rate up, and it gets your heart rate up into a zone that's considered moderate intensity or vigorous intensity, and you want to do up to 75 minutes a week of vigorous intensity or 150 minutes a week of moderate intensity physical activity. And as you can appreciate, that's even hard to just state out loud much. Let's explain what moderate means, what vigorous means, and how many minutes is 150 anyways versus 75, and how do you add all of that up. And the really nice thing about active zone minutes is it takes all the complexity away, right? Like it takes the math out of it, and all you have to do is achieve 150 active zone minutes per week. And that'll get you to the guidelines, whether you did more vigorous, whether you did more moderate, whether you decided to swim, whether you were gardening or just brisk walking. It really just takes a lot of the nuances out of it and makes it simple, achievable, and honestly more fun. And the part that gets me really excited is if you look at the research behind this, if you look at the studies of people who meet those physical activity guidelines, their health outcomes are pretty incredible. So there's a 40% lower rate of diabetes, 30% lower rate of heart disease. But then you look at things like falls, depression, and even cancers, there's 20% lower rates of those outcomes in people who meet the physical activity guidelines, who get, and one way to get there is to get to these 150 active zone minutes a week. So really, I think what it does is you take this dry science and you bring it to life and make it accessible to as many people as possible. That's super exciting.
Yeah, totally agreed. And you made some important points in there about how it's not, steps aren't everyone, right? That's not the way everybody gets their exercise, but active zone minutes, because it's agnostic to what kind of movement you're doing. It's more about just getting the heart rate up. It makes it available to many more people. And then your other point about accessibility, just making it so it's easy to do, engaging, empowering, inspiring. Those are some words that we use a lot in our work that we can't underestimate, right?
For sure.
It's hard work to be healthy. And the easier we can make that for people, right? Decrease the burden. Right? We've got to get kids to school. We've got to put food on the table. We've got a lot of things that are pressures in our lives. So I can't emphasize enough how important some of those points that you make.
So for sure. I'll just jump in there one quick fact. I'll just jump in and add one more thing there. When you say we have busy lives, and the really nice thing about active zone minutes, for example, is if you understand it a little, then you can work it into your life, right? Like if you have a 10-minute walk to take a kid to school or back, you could just walk a little bit faster on that walk and turn that walk into just steps to active zone minutes. And that way you don't have to build time in for exercise. You can build it into your life in a way that's convenient. So again, like really making it achievable and easy is sort of a critical component. But go on, you were going to jump onto the next thing.
Oh yeah, absolutely. So from there, nutrition. Obviously, nutrition is an incredibly important complement to activity. And you started to hint on another colloquialism that people use today, which is activity is medicine, right? It's such a powerful piece. But the same is true about nutrition. Nutrition really is medicine, and we continue to learn about the impact of both. And at Fitbit, we have food logging, water logging. We have content that's compelling around mindfulness around eating, about really interesting recipes that are engaging through video. And we also have some experiences that help people target specific behaviors that may be important in things like diabetes or hypertension, where we're helping them to kick back on the added sugar or the added salt in their diet that might be contributing there. So talk to me about nutrition a little bit and how that plays in.
Yeah, no, absolutely. I mean, it's such an important part of so many diseases. You mentioned big hitters like hypertension and diabetes, definitely very important. Like, you know, I trained at Hopkins. One of the key folks there was Larry Apple, and he showed that with the DASH diet, which is a dietary approach to stop hypertension, the diet actually was as effective and sometimes more effective than medications in lowering blood pressure. The challenge with nutritional approaches is how do you make them real for people, right? Like, so just the other day I had a patient who had heart failure who was explaining relatively new diagnosis. He was trying to understand his disease. And I was like, you have to cut down on the salt in your diet. And I had just a couple of minutes in my interview because I had so many other things to cover to say like, yeah, you know, generally watch out for things like that are super salty, canned foods, pickles, etc. And my 2 or 3 lines of trying to tell him about salt, and then he's sort of on his own. But with you know, a program like, you know, cutting down your salt and Fitbit, you have so much more support in bringing some of these recommendations that physicians have to life and making them easier to follow. I think that's super exciting as we increasingly understand the importance of nutritional interventions, of physical activity interventions. Finding ways to deliver them is going to be super impactful.
Yeah, and that harkens to our title, which is about becoming a companion for folks, right? It's not just about tracking these behaviors, but how do we live with them on a daily basis and be there for them when they meet roadblocks and fill those gaps between clinician visits, which are an incredibly important part of the healthcare journey. But how do we complement that and be their guide on a daily basis and provide that support? So thanks for hitting on that. From there, I think a lot about sleep. And sleep, the way I think about it is, if you're not getting a good night of sleep, you don't care about your activity and nutrition, right? It's just, I have a 2-year-old, right? Yeah. And it's tricky. I know you have young kids as well. Right. And it's not just young kids. There's lots of things going on in your life that affect your sleep. So we have tools at Fitbit now that help people with sleep hygiene, work on better sleep habits, to track their bedtime and wake time and try to achieve regularity with that. And also things like sleep score that help them to see on a daily basis. Talk to me about how sleep fits into this in your mind and what kind of role Fitbit plays in that.
Yeah, no, that's fantastic. I mean, I've been very impressed with the Fitbit sort of sleep programs for such a long time. And, you know, with the long battery life on the devices, you actually have much better sleep tracking and sleep data than just about anyone else out there. I think that the thing that, you know, I've come to appreciate as a clinician over time is this transition of sleep that's been considered as like a nice to have, a quality of life thing, to its actual impact on chronic disease, how it increases. Poor quality sleep can increase your risk for chronic disease and so on. And on the flip side, that if you start getting better sleep, there's some data that it helps you with improving metabolic health, improving weight and such like. So I think we're increasingly understanding the importance of sleep. And it's not just the long-term, you know, there's obviously the short-term effects too, right? So you just mentioned you wake up, you kind of don't feel like doing anything else. There's actually good data that if you end up driving and you're sleep deprived, that's almost as bad as like drunk driving, right? So like the quality of sleep and having good quality sleep can be so impactful, not just in the longer term on chronic disease and things like that, but also in the short term on like things like, you know, your risk of getting into an accident, you know, so hugely important in so many different ways.
Yeah, I love that. And what I'm hearing is it affects your ability to perform on a daily basis. It affects your ability to be able to focus on your health. Because you need that energy, and it affects actual physiology. And that's something I've learned about lately. We talked about how great it is to be part of this team of clinicians now at Google that supports Fitbit. And we have a sleep expert, Logan Schneider, who's teaching me about some of the intricacies about how regular sleep cycles really have a profound impact on metabolism. And increasingly, there's new evidence that suggests that things like metabolic syndrome and diabetes and hypertension are contributed to by your sleep. So it's not just getting a good night of sleep helps you to be able to focus on activity and nutrition, but it also has direct effects on your physiology that we're continuing to learn about. But in the meantime, we can be giving people tools to help them to optimize that consistency. Really exciting. Similar on mindfulness and stress management is that if you're overwhelmed, the ability to sleep is obviously impacted. Your focus on your nutrition and your activity is impacted as well. And this is an area where Fitbit, over the past couple of years, we've been making really significant investments. So we have mindfulness exercises now and meditations from experts like Deepak Chopra, other vendors in the space that we aggregate into the experience so people don't have to go multiple places, and Fitbit's own content. And we're doing some interesting new things like using electrodermal activity that allows you to get biofeedback while you do mindfulness. So basically you put your hand on the device, it's measuring the sweat on your skin, which gets regulated by your sympathetic nervous system. I'm getting a little technical here, but basically it's the fight or flight response that people have to stress. And we can measure a bit of that. And during a biofeedback of a mindfulness session, you can learn how to try to keep that in check and build resilience. Super exciting stuff that I think takes meditation and mindfulness that I think for a lot of people and even for a lot of clinicians feels inaccessible. It feels mysterious. And trying to make that more accessible to people. I love your thoughts on that front.
Yeah, no, for sure. I mean, it does feel very approachable the way Fitbit has done it, right? Like it's something that anyone can try. And I think we're increasingly realizing that just like physical health, physical diseases, diabetes, hypertension, so on, mental health is such an important thing. And it's just sort of bubbling up into the sort of public consciousness in so many different ways. And I think there's this concept of, sure, on the one hand, if you have a mental health condition, you should seek help, get a provider, and so on. But on the other end of the spectrum, like you can build your resilience. We all face stress. We all face different sources of stress. Some are, life stresses like situations that you come across, whether it's work-related, family, etc. But if you can use some of these tools to build up that resilience, then you're able to sort of put your best foot forward and tackle these things. So I think it's really helpful to have these tools accessible.
Yeah, we all encounter stress. And what we can hope to learn is how to let it bounce off of us a little bit more. And that's some of the skills that are in there. Yeah, I appreciate that. So from there, we've talked about activity, nutrition, sleep, and mindfulness. And we've hinted a little bit about just how important it is that these intersect with each other. But let's talk a little bit about creating an experience that thinks about the whole person and that makes sure to emphasize the importance of them in concert with each other. How important is that? And what are we doing on that front to try to make a difference?
Yeah, I'd almost flip this one around and ask you, like you're the behavior change expert. And so I'd love to hear your perspective on how all these different verticals, which have medical and physiologic importance, and how did you think about stitching them together in the very difficult sort of problem or challenge of getting people to change their behaviors, getting them to care, getting them motivated? I'd love to hear that journey.
Yeah. I think about it from two different angles. One is what we already touched upon. I don't want to dwell on that too much, which is being in a state of mind where you're ready to change your behaviors and where you have the energy, you're not totally stressed out, you're not devoid of sleep. That gives you the opportunity to build resilience, to work on activity and work on nutrition. So that's part of it. That if you only focused on a couple of these behaviors and you were missing out on the other ones, you'd be missing out on the opportunity to really help people because you'd be just bouncing off of a wall. You'd be telling people,
that. You got to prepare the groundwork first.
Yeah, you exercise, and they say, done. Turn it off, put it in a drawer. So that's number one thing is just communicating to people that this all matters and that will help them on that journey and help them find what they're ready for at what period of time. So that's one part. Then the other part is helping them to see the combined benefit, right? The thing about behavior change that's really hard is that it often takes a long time to see the benefit of what you do.
For sure.
Especially if you just focus on one behavior at a time, and maybe one, what we would call a physiological signal, something like your resting heart rate or your blood glucose or your weight or other. It can take a long time for those to change, and it can be very defeating. And so what we try to do is take these behaviors, make them easy to measure, make it easy for people to see the movement in the behavior. Then from there, we make it easy for them to appreciate the combined benefit. I may be trying to be more active because I'm trying to have better cardiovascular health, get my heart rate down. But as I do that, I find out that actually it impacted my weight, it impacted my blood pressure, it impacted my blood glucose. Now, but blood pressure isn't something that we measure in the Fitbit app now, but we do measure blood glucose, resting heart rate, and people can, and they interact with their clinicians around their blood pressure, so they're going to see that impact as well. So the more that we can communicate, and we have guided programs around things like reducing your salt so you can impact your blood pressure, the more we can make those connections for people, the more likely they are to experience a win. And once somebody experiences a win, they build confidence, and then they build that. And that's why I believe it's so important to have this multifaceted approach. A, you really have to make sure that you're not missing big areas that are going to just turn people off. And then B, you want to find every opportunity you can to build wins quickly, because those small wins spiral into bigger change. And if you try to shoot for the moon out of the gates, you will lose people. And when I was a clinician, we as physicians and nurse practitioners, PAs, others, we have an incredibly important role in diagnosis and therapeutic decision-making, but we're not there for people on a day-to-day basis. And the way people's brain works is they need to see change in a week or two. They need to experience value from what they did, otherwise they give up. So those are some of the pieces there.
No, that's fantastic. And I appreciate you lifting the hood on that, because I feel like people just see the product and they're like, oh yeah, I get some nudges or whatever, and it kind of seems to work. But like the complexity and the thoughtfulness it takes to put all of that together so it's as effective as it can be is pretty fantastic. I guess building up on that, so do you want to talk a little bit about the impact of this work and the studies that have shown, sort of whether this works or not?
Yeah, so, where you're driving this is that behavior change science is hard, right?
Yes.
Changing behaviors is hard. And the science, there are a lot of theories out there. And some of those stuff is common sense, like take goals, break them into smaller pieces, give people support along the way, not just an app, but their family members and friends.
Right.
But the reality is there's a million different ways you could do that. The only way you figure out how to do that best is you study it, right? And you iterate and improve. So there have been there's a couple of nice studies that I want to highlight recently that we're pretty excited about that we didn't do at Fitbit. We do a bunch of our own studies as well, and that helps drive the product. But what's really exciting is when somebody externally that we're not interacting with goes off and does a study. And the three I'm going to highlight are a little bit different. They're not about Fitbit on their own, but they're about Fitbit being a booster or rocket fuel behind things that other folks are doing, which I think, and I hope is the case for many of you on the call. You're at a health plan, you're at an employer, you're at a health system, you're a researcher. You're not thinking about Fitbit in isolation. You're doing lots of things to change people's lives when it comes to their health. And so what these highlight is potentially how Fitbit can be an add-on to that. Doesn't have to replace, doesn't have to be on its own island. It can be a boost. So one of those studies is a what's called a meta-analysis that was done recently that includes 37 different studies. And in every one of those 37 studies, there was one arm of a randomized controlled trial that included a Fitbit and another arm that did not. And in each one of those studies, those Fitbits were an add-on. And I shouldn't say the Fitbit, it's something I'm adamant about. It's not the device, it's the whole experience, right? It's the app, it's the community, it's all those pieces. But the Fitbit experience was an add-on to an existing intervention. And those interventions were focused around helping people get more activity and helping them to manage weight. And so because you have 37 different studies, every one of them has an arm without a Fitbit and with a Fitbit, makes it really definitive that you can say definitively, does this make a difference or not? And the really exciting thing is that people got more steps, more moderate and vigorous activity, which is the guidelines that you were talking about from the AHA and from our national guidelines. They got more of that activity and they lost more weight. Right. I think I like to emphasize that weight is an important measure in the bigger context. We don't like to think about weight on its own. There's a lot of challenges with just trying to do intentional weight loss. What we think about it is as another signal of impact of what you're doing in the bigger context. And the reason that I bring that up is if you're just trying to do intentional weight loss, there are other risks involved, eating disorders, et cetera. We think about weight in the context of really helping people to have healthier behaviors, and weight loss is a valuable side effect of that, that also helps people prevent diabetes, high blood pressure, et cetera. So this was really exciting. More activity, more weight loss in the context of healthy behaviors. And it was the first definitive proof that we've seen around wearables that they have this kind of impact. A lot of the studies in the past had looked at all comers. It was a least common denominator approach, right? It's like saying that, the hamburger that you get at one place is like the one that you cook at home with healthy ingredients, and somewhere else it's not so much. A least common denominator approach just blends everybody together, no matter how you do it, because the how is really important. So this was exciting. Another study was looking at diabetes, and it took individuals who are part of a diabetes app. It was the leading diabetes app in Japan and Taiwan. And they took individuals who were on that app, gave them a Fitbit that then connected into that experience, and they measured their diabetes outcomes before adding the Fitbit and after. And the exciting thing was that individuals who, once they had that component added, they had further decrease in their LDL cholesterol, in their hemoglobin A1C, and in their blood glucose. And then the third study was one of diabetes prevention program by a company called Solera. And everybody who gets started to a certain point in a diabetes prevention program, Solera pulls a bunch of different programs by different vendors together. And anybody who gets started in one of those programs and reaches a stage, they get a Fitbit. And they did a study of those that reached that stage who redeemed a Fitbit and not, and a remarkably higher percentage of folks reached the key diabetes prevention program outcome of 5% weight loss or more. It was actually 1.4 times as many people reached that. So pretty significant improvement. Small cost to add on to an existing great program to boost its power. And that's the same theme across these. You guys are all doing great work. How can this boost what you're doing?
I mean, that's fantastic. And what I love about that is what I really love about that is one, the evidence. So I have a PhD in epidemiology. I love research because it informs, right? Like evidence-based decision making is really, evidence-based medicine has really come to its the front lines in the last decade, and it's wonderful to see that evidence-based building up in this presumably consumer technology space, right? Where we're actually showing health benefits of consumer technology. So I think that's fantastic. And then what I love about all of that as well is the add-on component, right? Like we're not trying to wall you off into just one solution and this is all you can use and that's the only way you can get benefit, but rather how can we all work together? So I think that's super exciting for sure.
This is a big problem, affects people around the world of all different types. And however we can work with others to solve this, that's the way to do it, right? There's such tremendous opportunity here and so much space to succeed in that I think that's the way we need to think about it. And it's the way we've got to improve. We have to measure what we're doing. We have to prove that it's working. Some of the things won't work, and then we need to iterate on them until they do.
Yeah, and that's the thing, right? Like that's the beauty of evidence. Like you don't know, especially when somebody else does the research. So it's a independent study, and sometimes it'll be in your favor, and sometimes it won't. So it's even more validating when it's external. I think at this point we were going to move on to measurement and detection. John, if you wanted to. Yeah. So, in addition to all this wonderful behavior change and options, Fitbit's also a fantastic measurement tool, right? So we have so many metrics. You have resting heart rate, weight, blood glucose. You can check your respiratory rate, oxygen saturation, even skin temperature, and most recently, EKG with atrial fibrillation. Now, as a cardiologist, I'm particularly excited about the EKG, and I'm happy to jump into that. But I wanted to give you a chance to just sort of talk a little bit about this range of options that come in terms of the measurement component of it and how sort of they might inform detection of conditions.
Yeah, I think about all these measurements in two lights. One is to give more and more options for people to see the impact of their healthy behaviors, because that's what's going to drive them to stick with it. And the more we can capture there and the more we can illuminate for them with very little work, the more likely we are to succeed. Because people don't just go out and try to get healthy for the sake of getting healthier, right? It's just not the way it works. They have some purpose that's driving them. We help them on that journey, but the more we can illuminate all the impact that it has, the better. Then where you're headed is, what can we also do more passively that we might be able to screen for a disease or detect something early that they might not have even been concerned about before.
Exactly.
So yeah, talking more about EKG and AFib, I think is a prime example of that.
Yeah, and so one of the things, as an epidemiologist, one of the things I think about is promoting sort of well-being in a community. And so in that context, screening for diseases, right, is an important tool that you have. So whether it's like colonoscopy for colon cancer or pap smears for endometrial cancer, et cetera. So there's different ways that the public health profession does screening, but that's historically been where you set up a program, you have a test, you administer this test to a bunch of people and sort of see what happens. The wonderful thing about EKG and AFib detection from heart rate is that this reaches people where they're at, and so it creates a new paradigm of screening, which is called opportunistic screening. So instead of just screening everybody in a standard way, what we're doing is you're saying, hey, you happen to have this on. If you have symptoms or if you feel funny, you can just check your EKG. And if it shows at that moment that you might be in atrial fibrillation, go talk to your doctor and see if you might have this condition, get a proper workup for it. And being present at that moment allows you to do a screen that, you're there for that person at the right time and able to give them this opportunity, hence the opportunistic, that they might not have otherwise had. So I think it's super cool, and I'm excited to see sort of where else this goes.
Yeah, and atrial fibrillation is the most common abnormal heart rhythm. It's often asymptomatic and often not continuous. So you go to the doctor's office, there's this term called paroxysmal, which basically means it's intermittent. And so you could go to a doctor's office and get screened and no one would see it. So there's this tremendous advantage of being out there in the wild with people. And it leads to strokes, like serious adverse outcomes. So if we can help detect more people in a population, there's this tremendous potential public health benefit there.
Yeah, no, that's exactly right. So, I see this all the time in clinic where somebody will come in they might have had palpitations or something. I checked them and there's nothing there. And so then you have to do more workup to get to them and figure out what it was. So again, having it sort of at the moment is super helpful. Major public health problem. Millions of Americans are affected by it. So yeah, I think this is super exciting technology. And again, as a cardiologist, near and dear to my heart. So excited to see where that work goes.
Yeah, me too. Just a disclaimer on that. We don't do the diagnosis, but we do the screening, which helps to then people get into that diagnostic pathway. But that we think is a big contribution, because if nobody knows to go and ask, then they won't get that.
That's exactly.
So from there, we wanted to, we're closing in on wrapping up here and getting to your questions, but a couple of other quick things we wanted to talk about. One is that we talked a lot about how Fitbit is intervention for populations and for individuals, obviously, right? It's a tool to inspire and empower people to live their healthiest lives and to measure things that matter and help them to succeed. But it's also a tool, a platform that can allow for new innovation, new research, et cetera. I'd love to get your thoughts on that, Kapil.
Yeah, I mean, absolutely. One of the best things about Fitbit is it's one of the most widely studied wearables, right? There's over 1,000 published studies exploring the impact of Fitbits, and in very creative ways, everything from surgical recovery to cancer and many others. And even more exciting is that Fitbit is part of the NIH All of Us Precision Medicine Initiative. So that's an initiative where we're collecting information on over 1 million people, and that will include information on wearables. And so we get this really interesting look at how wearable data combines with all the other types of data, EHR, medical, genomic, et cetera, to see if it can inform outcomes. And I think we'll find even more interesting use cases of this. And then one of the things that I was particularly excited about is, John, you have this health equity research initiative, and I'd love for you to share a little bit about that as we sort of wind this down.
Yeah. Nova on my team has spearheaded this initiative where we have a health equity research program where we're giving out devices, services, support to early stage underrepresented researchers who are working on health equity problems across the country. We worry about the digital divide. It's an important consideration as we build technology that the specific purpose of our technology is actually to improve equity, right? We can get this technology out to people, any geography, bring the prices down so it becomes really cost effective as a tool to help improve the health of individuals. But there's still a risk that the research work that really informs on this isn't done with the populations who need the greatest help. So we've put together this program and we have applicants in already, and we'll soon be announcing the first class of researchers who will be doing this very important work that we are delighted to be able to support, so that we can make sure that this work going forward is benefiting everyone in an equitable way that really advances the science.
Yeah, that's just fantastic. I think it'll be really exciting, and I'm keen to see what people come up with and where the science goes. I think as we wrap up, the thought that I wanted to leave everyone with was, how does this all fit in with medical care, and how does it help with conditions like diabetes, hypertension, and chronic disease? I think John and I were talking about this earlier, but it's really complementary, right? Like you have your clinician visit, you have all the medical devices that we use when you come into the hospital and so on, and you get all of that information, and then you leave and we don't see you again, maybe for a few months or until next time you're in the hospital. And that during that time, John, like you were saying, the thing that's with you is your device and the different measurements and the different programs that you have. And I think these two complement each other really nicely in supporting people in that journey from, in trying to manage their chronic conditions and get to those healthy behaviors while tracking all these various metrics. So yeah, I think this is just a really exciting time to see how we can blend these together. And John, I think we could wrap up with, if you had any last thoughts on that. I know I'm certainly excited about it in terms of as we connect the two worlds together, I think there'll be more and more opportunities for impact.
Yeah, it's relatively new in the history of medicine that clinicians are recommending things like home blood pressure cuffs and other devices, but there are always concerns about how that fits in with the measurements that are done in the office. But there's more and more validation of that. And now it's not just about devices like a home glucometer or home blood pressure cuff, but it's also the wearables and other devices that provide people support for the behaviors, that augment the signals that we can collect so that we can really know what's going on out there. And you see more and more clinicians recommending wearables of all types to people because of some of the things that we shared with you. The evidence is growing. The more the evidence grows, the more you're going to see clinicians embrace this. And what we're trying to do at Fitbit is create reports and tools that users of the devices can take and share back with their clinicians. Clinicians don't have time to sort through all of your steps, right? We have busy days. We've got diagnostic and therapeutic decisions to make. We need to distill down all of that information into really actionable constructs. And we're doing things like that with people's trajectory of their activity, of their sleep, of their rate, and doing the same thing with things like atrial fibrillation detection. If we see things happening on the device, summarize it really nicely on a page that the individual can take to their clinician. They can send it to them electronically, or they can bring it with them physically so that we can start to bridge that gap. I think the future is exciting. I think there's going to be all kinds of things happening on that front in the future. But in the meantime, health plans, employers, researchers, health systems that are building particular programs for disease management are really making it happen until it becomes more a part of the day-to-day life of medical care. We see all of the folks like you being innovators that are making it happen even earlier. So we're excited for your questions. And fire away. This has been a fun chat. Thank you, Kapil. I'm always learning things when I'm chatting with you and another new colleague. So this has been really great.
No, this is great. Thanks, John.
Hi. Thank you so much for that really insightful discussion.
Absolutely.
Yeah, I'm just going to ask you guys a few questions that we've gotten. That's all right. We'll get started.
Yeah. Go for it.
So what is drop-off period for Fitbit utilization, and what factors influence continued use of Fitbit?
Yeah, sure. No problem. I can't give you specific stats on the drop-off rate because that depends highly on the usage scenario. It depends highly on what that scenario being, what indication is the person using it for, and in what environment, with a health plan, with a health system, with an employer. It's all very different depending on how it's used. But the second half of that, I think, is useful to dive into. What impacts the duration and the engagement level of the person. There's a lot of things that impact that have to do with the person's level of confidence and their level of motivation in being able to succeed at different behavior change processes that drive a lot of that. And what we try to do is nurture that, right? So we try to provide more and more support as opposed to just sending data back to people. Try to help understand their context and give them more support, and also leverage friends and family and things like challenges that make it fun. The reality is, as we mentioned in the talk quite a bit, behavior change is very difficult. It's very important that you don't make it overly scientific, overly structured. You need to make sure that there's some fun and social elements to it, but at the same time, you keep it serious enough because this is a person's health that you're dealing with.
Awesome. We have some great questions here. So what drives the sleep tracker? Sometimes Fitbit confuses sitting still with sleep. So what triggers the sleep tracker to record?
Yeah, no, that's a great question. So I'm a cardiologist. I'm not a sleep expert, but I did touch base with our sleep experts from time to time. And so what I understand about the algorithm is that
there are trade-offs. And so one of the inputs to the algorithm is whether somebody's moving or not. And so it is true that if you're absolutely still, let's say you're meditating or you're just still for other reasons, the algorithm can sometimes have a hard time distinguishing sleep from non-sleep. That said, it's actually pretty reliable. So there's independent studies of Fitbit's sleep algorithm, and there's a meta-analysis of several thousand people, I want to say like 3,500 people, that looked at Fitbit devices vis-a-vis like polysomnography, which is like the gold standard for sleep labs and testing. And they were quite, within a reasonable sort of range, accurate. The other thing to remember is that I think more than any individual sleep measurement, patterns are more important. So understanding your patterns over time. So if it tends to overestimate your sleep, it'll do that the same way every day. So seeing what your patterns are doing over time is actually more important than any one specific number.
All right, another one. What are the largest barriers for consumers wearable tech to be widely adopted to drive health interventions? Sorry.
Sure, yeah, I can field that one. I would give it two components. And we touched on both of those in this talk, but putting them together here, I think makes sense. One is, instead of just feeding data back to people, give them support and guidance. Most wearables experiences and most health apps start with just a deluge of data to the user, and that's hard to really put into action. So one is really giving people guidance and support and making them feel like the experience is personal, right? Because that's what people want in their health. So that's number one. And number two is evidence, right? In the end, it has to work. It can't just have cool features. It needs to have impact. And that's where
Hi, I'm on a webinar.
That's where we spent quite a bit of time on the talking about some of that evidence, because we believe that being part of that movement to generate more evidence about wearables and health apps is really critical to get adoption.
Awesome. All right. How does technology like Fitbit fit around regulations like the FDA? And would they ever pivot to be classified as a medical device?
Yeah, no, that's a great question. So as we touched upon in our in the webinar itself, Fitbit does have some FDA cleared featured. So two of the devices, the Sense and the Charge, the latest version of the Charge can actually take an EKG, and that's FDA cleared. And what that's cleared to do is to determine whether that single lead EKG, it's a qualitatively similar to a single lead EKG, is an atrial fibrillation or not. So I think the spirit of this question is like, are we heading towards that direction of getting sort of more rigorous health use cases? And I think we're already there. We have some features that are FDA cleared, and I think there are more to come. And so I think it's an exciting time to be doing this work.
Perfect. All right. How can physicians use smartwatches now to help themselves and our patients' well-being?
Yeah,
Sure.
I know that's a great question. I'll let John start and then I'll jump in.
Yeah, thanks, Kapil. So the first part of it, I would say, given the evidence about the impact on things like activity, moderate to vigorous activity, steps, weight management, etc., suggests that it could be a really positive complement to what clinicians are doing in helping people to manage diabetes, hypertension, cholesterol, etc. Right? The stats about clinicians being able to help on those fronts are challenging, right? Because they have so much work to do on the diagnostic and therapeutic decision-making side that the amount of support that can be provided on the lifestyle changes is hard. So think about it as a complement to that, especially with this increasing evidence that Fitbit combined with another intervention, in this case being traditional clinical care, can boost those outcomes, whether it's prediabetes or diabetes. And then hopefully we start to get more and more evidence about other things like blood pressure and cholesterol, et cetera.
Yeah, no, that's a great story. And I can build on that. I think the thing that I'd like to emphasize beyond that is this is a really difficult time to be a physician and a provider. The pandemic has put a huge strain on the health systems, and there are many structural components. So I don't want to minimize that, oh, you can fix this by giving somebody a wearable or something like that. But what it has reminded us is that it's important for physicians to take care of ourselves as we take care of others. And Fitbit's, I think, a fantastic tool. I gave a talk at the American College of Cardiology about digital tools, and this is one of the things I mentioned, that what gets measured gets addressed. And if you start measuring your activity and your sleep and things like that, you can start to take care of yourself. And not only does it help your physical and mental well-being, but then it allows you to function at a higher level. So you're bringing your best to your job and to your family, and dealing with some of these challenging times a little bit better helps build up that resilience. So I think there's a tremendous opportunity for providers to take better care of themselves and then learn these tools to then help their patients as well.
Awesome. Well, I want to thank you guys again for coming to our webinar and having a fantastic discussion. I thought it was really great. I'm sure everybody else thinks it was really great. So I'm just going to quickly wrap up and let everyone know about our upcoming events. But again, I thank you guys for joining us. I'm just going to pull up the slides so everybody knows of what's coming.
Thank you for the opportunity. This was wonderful.
Thanks for having us. We appreciate it. Thanks for everyone who joined.
Yeah.
All right. All right. And our events plan. All right. All right. Well, thanks again for everyone who's joining. Hopefully you guys can come to a few of our next ones upcoming. You can see them up on the screen. And if anybody is a member of EHI, feel free to jump in on our work groups and briefings. Those are coming up as well. And if you're not a member, feel free to join. We'd love to have you. So thank you so much and have a nice day, guys.